Should you exercise even if your muscles are sore? Should you reach for a Wheatie bag or an ice pack if you have a little bit of pain? And what are some things that you can do every day to prevent long-term pain? My name is David Toomey. I'm a senior physiotherapist and lecturer here at AUT. And today we're going to be going through Physiotherapy Matters. So the first question we have is, what does a physiotherapist do? And it's quite a broad question, but it's a very interesting one. Physiotherapists do a lot of things. We might think of a musculoskeletal physiotherapist working in a sporting setting. We might think about a neurological physio in a concussion or stroke rehabilitation setting. Or we might think about a cardiorespiratory physiotherapist working with chronic obstructive pulmonary disease or helping somebody to get moving after some sort of respiratory condition. No matter what the setting, the role of the physiotherapist is often the same, and that's to help people move more with less disability, more function, and a little bit less pain. So no matter what the story, the goal is always the same. Let's get people moving and keep people moving with a little bit more ease. Okay, so the next question is, what's the difference between acute pain and chronic pain? Acute pain, we often think of it maybe more short term. So, or pain is often a threat appraisal system, like a body's natural alarm system. In a chronic pain kind of environment then, it's when things have maybe gone on past the stages of natural healing times. So usually this is when we go past maybe 3 months. And in that instance, pain might be a little bit more representative of an oversensitivity of the alarm system. We have a question here, should I avoid exercising if my muscles are sore? And that's a fantastic question. It's something we often get asked as physiotherapists. And the answer lies in how the muscles became sore. So if it's a sharp pain that happened as a result of some sort of accident or something like that, then temporarily backing off and letting those tissues settle down and encourage a little bit of healing, that makes a bit of sense. Usually gentle movement will still be absolutely fine in that scenario. We like to think about mantras like motion is lotion or movement is medicine. So it's rarely a case where exercising is off the table entirely. Then the next instance might be what we call delayed onset muscle soreness, or DOMS for short. And that is often, if you think about doing a gym class where your sadistic instructor has given you a menu and a smorgasbord of squats and lunges and deadlifts, and after it you have equal soreness between left and right leg all over the quads. That's often just a sign of an unaccustomed or unfamiliar exercise, and that's all good. You just let that settle down or introduce some gentle exercise and you'll be good as gold. We have a question here, what kinds of treatments do you use to help people manage their pain? Often the best place to start is with the end in mind. So what would this person be doing if they weren't in pain? And if we know somebody's goals or their aspirations or things that are meaningful and significant for them, then we can reverse back or reverse engineer a type of treatment approach. And then that way we can think about fitting the treatment to the person rather than the person to the treatment. And those treatments then, it might be some hands-on type therapy, like manual therapy. It might be some exercise. It might be introducing some modifiable lifestyle factors, like trying to improve somebody's sleep hygiene or stress management or stuff like that. So rather than thinking about the treatment, we often think about the person. I have a question here. My physio wants me to try acupuncture. Should I do it? I have tried to refrain from being what I call a cocktail party physiotherapy, where I'll offer a small snippet of advice without getting the overall picture, because whoever's asking this question deserves a full, thorough assessment and management plan. But in short, it kind of maybe depends on why acupuncture might be being offered. So I think a really nice conversation or collaboration, shared decision making between the patient and the therapist is really important here. What is the patient or the therapist trying to get out of acupuncture? And if it makes sense and there's honest and informed ongoing consent, then it could be worth a try for sure. Often acupuncture is not the mainstay of any type treatment. We think of it almost like the sprinkles on top, and maybe your ice cream and your ice cream cone might be the big rocks. So things like what exercises are you doing, or what are the main things that might be influencing your pain. The next question here is, how do you decide what treatment somebody needs? This is a marvelous question, and the answer is we kind of figure it out together. So we think about collaboration, we think about co-constructing what somebody might need. Sometimes it might be pain relief, but other times it might be reassurance. Somebody wants to know, is this going to be long-term? Somebody might want to know a prognosis of how long is this going to take. Somebody might know exactly what's going on, but they just need a little bit of a plan or a guide. And in that way, you're kind of coming into a role almost like a Sherpa, or what I call a guide on the side, to help somebody get to where they're going. So the answer is teamwork together. That's how we decide. How does stress or anxiety affect pain? The best way to think about things like this, stress, anxiety, mood, they can often be like volume dials or dimmer switches. And when life gets loud, these things like stress and anxiety can really kind of ramp things up. If you think about if you're stressed or you're anxious and somebody cuts you off in traffic, you might not be too pleasant. However, if you're having a great day and somebody cuts you off in traffic, you might be happy to let them go. And often it can be the same with stress or anxiety. Maybe you might have a pain that you would rate at a 5 out of 10 on the numerical pain scale. But if you're stressed or if you're anxious, that might be dialed up towards a 7 out of 10. And rather than just thinking about it negatively, similarly, these volume dials can be dialed down. So from a treatment perspective or a management perspective, we might try and indirectly influence somebody's pain by trying to affect maybe the stress or the anxiety. Here's a good one. What's one of the most surprising things people don't know about pain? And I think one of the most surprising things that people don't realize is that pain isn't all bad, as strange as that might sound, because pain is often a strong motivator. It's a threat appraisal system. Think of it like a car alarm. And if you would want to have a really decent car alarm to protect your car from getting burgled. However, sometimes that alarm can become a little bit overly sensitized or sensitive. And it might mean that your car alarm might be going off even if a soccer ball is touched off the car, or even if somebody walks past. So it's not always directly representative of tissue damage. The other thing is that it kind of speaks to us in some ways. So your pain can tell you, or a little bit of a tailor a path maybe, of some things to avoid, maybe some things to kind of gravitate towards. So rather than just thinking of it as this inconvenient thing, let's try and think about some of the additional information that pain can give us to provide better outcomes. We have a question here. Are there things we can do every day to help prevent long-term pain? Well, it's important that we kind of get that 10,000 foot view first, and that's where we might look at social determinants of health. So things like income, housing, access to safe places to exercise, and roles and responsibilities within a social setting all can influence how active we can be. And then at an individual level, absolutely, in order to try and prevent long-term pain or persistent pain, we might think about being regularly moving. We might think about things like being socially connected, pacing activities, staying strong, thinking about our stress management, and all those marginal gains that we can influence. We're into myth-busting mode here. We have a question which is, what is one myth about pain that you wish everyone would stop believing? And one of the big myths that I'd like to bust is that a lot of people think that they need to have scans. And one of the issues now is that scans are super, super sensitive. So they're going to pick up normal age-related changes. For example, I have lots of grey hairs on my head and I have lots of wrinkles on my forehead, but it doesn't mean that my head is sore or that my forehead is sore. And that can be the same when people have scans like MRIs. They might pick up some wrinkles on the inside or some age-related changes that are absolutely fine. But if the findings from these scans, if they're not interpreted or kind of relayed to the patient in a very robustness affirming way or confidence affirming way, then often they can read very, very scarily and can actually kind of make a person feel like their pain might be worse than before they had a scan. So we really need to think about when scans are useful and how we might relay some of the findings from them. The million-dollar question: how annoying is it when patients or clients don't do their recommended exercises? And once upon a time, it used to absolutely grind my gears. I was kind of this impression that everybody had the same 24 hours in the day, and if it was important to you, you'd make time for it. And patients would come up and they might not have done their exercises. The dog ate their homework, and I would give them 3 Hail Marys and 1 Our Father to repent. But now I think of it in a very different light. If I attribute the blame, for want of a better term, towards the patient, then I've taken my ability to influence the situation away. Whereas now I approach it with a lot more curiosity. So I want to know why the person hasn't done their exercises. Is it because I haven't explained them to the patient themselves? Is it because there's a disconnect between doing a gym-based exercise and being on the pitch or the paddock performing and scoring goals and tries? Is it because the person simply doesn't have time? Maybe I've given them 10 exercises and they only have time for 2. And when we approach this kind of interaction with a bit more curiosity, then we can find the kernels or the gems to which we can then have a secondary exercise program that's a lot more likely to succeed and work. This is an interesting one. Is a heat or an ice pack better to help ease pain? Well, interestingly, from a pain relieving perspective, they often operate on a similar pathway in that if you hurt your knee and you rub it, you bang your knee and you rub it, essentially you're trying to kind of confuse or dilute some of the information there that would be interpreted as pain. And when we think about heat or ice, we're trying to influence or dilute those thermal receptors in a similar way. So ultimately, it doesn't really matter from a pain relieving perspective which you use. Personally, the Wheatie bag is a lot more inviting than the stodgy frozen peas, but try it and see which works for you. The next question is, what's the most common issue physiotherapists deal with? You might not be surprised to know it's low back pain. Low back pain is the world's leading cause of disability. It's estimated that there's a lifetime prevalence of 80%. So 8 out of 10 people will experience low back pain at one point in their life. But the awesome news is that the majority of this just settles down. And physiotherapists can play an amazing role there to reassure you, to help you keep moving and gently get you back into all those awesome things that you usually do. And then if it tends to be a little bit more persistent or ongoing, absolutely physiotherapists can similarly play a fantastic role to help you manage and to help you gain control over your life so you can really get back into those cherished and meaningful activities. Thanks for watching Physiotherapy Matters. Hopefully you have a clearer picture of what physiotherapists can do and how we can help you with pain and enjoy your journey through life with more confidence, more movement, less pain and less disability.